with large contact areas, so using the flats of your hands is a classic way just to perform some effleurage. This is a T technique where we come down the spine and then span out the bottom, making a T shape. A nice simple one to do. If your arms are not quite long enough for this technique, then you can go ahead and stand on the side of the patient and just perform that technique on one side. And then come through onto the other side. Continuing on, I'm now changing the direction and going up the erector spinae, over the traps and sweeping out around the shoulder, still keeping that broad, flat contact point so I'm not bashing or crashing into the shoulder blades, and just smoothly coming around, maintaining the contact, but putting most of the effort into the upwards sweep over the top of the shoulder, reducing the pressure as I just glide back down to the lumbar spine and back up again. Pretty much using one hand, and then the other hand is just over the top to reinforce. That just makes it easier for me, reduces fatigue. And another key point to make here is your positioning as well. Make sure the couch is at the right height for you. Bring your feet wide apart so you can use your legs and lower body to move, so your upper body is not too dominant in the delivery of the treatment, which can certainly fatigue the smaller muscles around your shoulders. So a wide stance makes the massage easier. Having your arms straighter means you're going to use your whole body and the muscles in your legs rather than using your triceps to deliver the treatment. It won't make much of a difference within a few minutes, but if you've treated clients for a few hours, you'll certainly notice a lot less fatigue in your arms. Another important point for me to get across on this course is not to overuse your thumbs or your wrists. You will notice that I won't be using my thumbs that much in this course. You'll see some techniques, ones you may already do, have been taught, or techniques that you see online, where the technique is brilliant, but they're using their thumbs a lot. For example, to get into the QL, they may be pressing into the QL with their thumb, pressing over the top there. These techniques can be highly effective. However, they're also effective at fatiguing and stressing your thumbs, which is definitely something to avoid. Manual therapists frequently suffer from thumb issues, and I really believe that can be avoided if you don't overuse your thumbs in the first instance. It will feel fine when you're doing this for a while, but the cumulative effect of doing that throughout the day, for a week, and for many months or years during your career. And on this course, we'll be trying to use more of the forearms and paying attention to techniques which greatly reduce the stress through the thumbs and wrists. This is one of my favorite warm-up techniques, the figure of 8 over the lower back. Again, just make sure you use your lower body and don't rely too much on the strength of your arms to perform that technique. So have a wide stance and move your body around, side lunging from one side to the other in order to deliver that treatment without causing yourself too much unnecessary fatigue. The next technique is a lateral stretch technique using the forearms this time. Start over the center of the spine, lean over the client, and then start to span out, bringing the arm towards us and the other arm away, giving that lovely lateral stretch through the back. Take your time with this one. Move slowly and don't force the glide of your forearms. Just let the natural resistance against the skin control the speed. And at this point, it's appropriate to start to introduce the control of the breath into the treatment. So I'll ask my client here, Richard, to take a breath in and relax and breathe out slowly. As he breathes out, that's when I'll apply the pressure and stretch out that fascia laterally. Coming all the way down over the side of the ribs, down over the side of the pelvis there. We'll now bring in some forearm techniques. So bring that forearm up the lumbar spine, use the other hand to reinforce. As you get up to the shoulder blade, you can rotate to pass past the shoulder blade up the erector spinae there, and then bring the elbow in and let the elbow come up towards the neck. I'm just going to adjust Richard's positioning there, so drop these sides down, up the erector spinae, rotating through to pass on the inside of the scapula, transferring the weight onto the elbow, up into the upper traps there, and finish. Okay, keeping that contact point with the patient as we come back down, back up again. And repeating that on the other side. Here's some other forearm techniques you can do. This is a petrissage forearm technique. So just working over the QL region on the side nearest to you. You can move the forearms up and down. And then start to move further up over the thoracic region and over the lats. The faster you go with this technique, the more friction you're going to cause, and that'll definitely have a warming effect over the skin. And I would then come around and repeat that on the other side. During this course, we'll also include some mobilization techniques. So for the warm-up, we can start with this one, gentle pelvic rocking over as you're stabilizing over the lumbar spine, and applying some pressure over the erector spinae, progressively moving up from the lumbar into the thoracic. If there are any stiff or tender points, then more focus and more time can be applied over those particular regions. Now, let's move the patient onto their side to complete the warm-up techniques. With the patient turned into a side lying position, make sure that they are comfortable, so knees bent up slightly, pillow and a towel under the arm there. You hold onto the shoulder and the arm for stability. And then use the base of your palm to come in from the lumbar region, just dropping off the back of the pelvis, and then moving up over the spine like so. Have a look at my position there. Feet wide apart, I'm in that lunge position, getting the arm in. I'm actually tucking my elbow into my lower stomach there, so I can then apply the pressure using my body weight rather than having to push in too much with my arm. It then makes it very easy for me to perform the technique up over, through and towards the base of the neck. Okay, it's a lovely technique. Some people prefer to treat inside lying, so you could probably do a lot more of your warm-up inside lying if this is preferable for you and more comfortable for your client. So have a try and see which one you and which one they prefer. You don't usually need to turn the patient over to target the lower side. You can also work through that lower side with the patient lying on the same side. You can then reach over and petrissage over the spine and focus on the lumbar area as well if you want to. You can reach this side, although it's a little awkward to be leaning this far over the patient. So I would suggest you focus on the upper side instead and turn the patient over should you want to target that side as well. You can also bring the forearms back in here and do that forearm petrissage technique, really working through the side of the torso and starting to mobilize some of that quadratus lumborum muscle tissue as well. Then moving up over the lats, over the back of the shoulder, before returning back down again. Now, I mentioned at the beginning of the course not to overuse your thumbs, wrists or fingers, but there is a nice technique you can do of palming down over the erector spinae, which is most easily performed over the erector spinae on the opposite side here, on that lower side. So with the palm placed over the spine, you can get a bit of grip through your fingers and then push down using the base of your palm, the thenar eminence there, to roll that tissue away from the spine. We can also add in here a bit of gentle spinal rotation as well whilst he's on his side. So by bringing his upper body towards me, just by pulling his shoulder over like so, and then pushing his pelvis back, we can just impart a nice gentle rotational stretch through the whole of the spine. So just moving there within range. We can bring the breath in again, so taking a normal breath in and relax and breathe out. As he breathes out, the rib cage relaxes, and that allows me just to mobilize him a little bit further. This is not a manipulation, by the way, just a gentle rotational stretch. Perfectly normal movement that you're just aiding and encouraging the client to do. We can go the other way, so pull the pelvis towards me, gently push the shoulder back towards you, breathing in, and relax and breathe out. Relaxes the rib cage, shoulder away, pelvis towards you, and a gentle rotation. Okay, remembering this is just the warm-up techniques to begin with, so we don't want to do anything too vigorous just yet. But many of these techniques will also give us an idea of points of tension, points of restriction, and areas that may need more work as we progress on through the massage session. To finish off the warm-up, it's a good idea to encourage the patient to get into a few gentle stretch positions. We've already done a bit with the rotation. We can add in some side flexion by dropping the leg off the couch there. I'd normally stand around on the other side to stabilize the patient, but obviously be blocking the camera, so I'll just stabilize here with my hand and then arm up and over, Rich, so we get a nice lateral stretch down through the torso. We're going to do more work with this later on in the course, but these are just some simple stretch maneuvers to finish off the warm-up. So if you bring that arm back over again, bring that leg back on. Cobra stretch, we all know that one, so we'll encourage the client to do that for us. Coming up to the Cobra stretch, nice, fantastic stretch through the spine there, and then dropping back then into the child's pose, Balasana yoga stretch. Okay, so as I mentioned during that, the warm-up, the massage, the palpation, and the movements that you get the client to do can all give you an indication of the areas that require more attention and the focus of your treatment. Perhaps it's a particular muscle on a certain side, a certain region, or a particular movement like left side flexion or rotation or extension, for example. And this course is put into modules so you can focus on those particular movements. So that concludes the warm-up. Let's move on to the next section of the course.